try and empower them to integrate into their new communities. Okay, about research. I know even in my report I say we ran workshops to create awareness of research. To be honest, the groups that we work with do understand what research is. Sorry, Shami, to put you on the spot. I remember a couple of years ago, I was trying to work on we were working on some research for the Department of Health. And she said, this group has been over-researched. We are over-researched. Just go back and use the information that you've already collected from us. We see people come in, extract information, go back, and we don't see anything afterwards. So, what we did was not create awareness, but more like encourage people to participate in research. And the way we were doing it is, maybe first I would say, whenever I talk about something that I'm passionate about, I want to lean on something or sit down. Those who know me know that. So maybe what I need to say is, within Inini, even though we see individuals from all 5 continents of the world, maybe 90 to 93% of those individuals are of Black, Sub-Saharan African heritage. And I am quite certain most of us know how overrepresented they are amongst inequalities in health, in housing, in employment, in everything. So my stance was, even though we are tired of doing research, of participating in research, as long as we do not put our voices out there, we are still going to continue to struggle. Our focus is mental health, and looking at the assessment tools used today for mental health. Most interventions, most tools are all Eurocentric. They do not meet our needs. So the reason we are up like this is because we want to put our voices into designing interventions, into how data can be collected, how data can be analyzed, how do we structure the ethics forms, how do we do the analysis, how do we report, and we don't want to just be we don't want to just be participants where data is collected of us. We also want to analyze that data. We also want to disseminate that data. We also want to be there when interventions are being designed and delivered. And we want to give our feedback. So I'm just trying to see where I wrote the barrier. Okay, fine. We did 8 workshops. We ran peer support groups across Coventry and Warwickshire, and we do have 4 groups that so we used the very same peer support groups to deliver the workshops. So in total, we delivered 8 workshops. So the feedback was there's research fatigue. Research relationships are extractive. There's lack of trust as researchers rarely come to feedback. That lack of trust can be identified anywhere and everywhere where we try to access social It could be social activities, it could be social services, it could be healthcare, employment, housing, whatnot. That trust is not there anymore, which is why we continue to say they access services when they are already in crisis. What do you want me to do? I don't trust you. Why should I be coming to you? I'm just about to round up. So there's also fear that participation may affect people's immigration status. We understand, particularly between the NHS and the Home Office, that they do share information. Now I don't know. I was minding when I was completing the form today. It's about you asking about the address, and people saying, why do they need my address? Because we are afraid. There is a lot of fear within the migrant community. There's a lot of fear. So when the information that you ask for, you need to clarify or to explain further what that is going to be used for. And we trust that what you say you're going to use the information for is exactly what you're going to use it for. And you're not going to be sharing it with anyone. Transport costs. If you're asking us to travel for research participation, we can't afford. We can't even afford the time. I was looking at a post on Facebook yesterday where somebody said, indefinite leave to remain is due. I've got 5 children, and that's 7 of us. They need £22,500 to apply, to renew their visas. And this is happening every 2.5 years. How much are they earning? So you see, time. Even if I wanted to participate, I don't have the time. I think that's more than enough. If you need to know more, I'll be sitting at the back. So you can always come and chat if you want more information. I'm all happy to share information with you.
Yay!